Good morning. The first item of business is general questions, and at question number 1 I call Emma Harper.
Thank you, Presiding Officer. To ask the Scottish Government what support it provides to people who are going through family court proceedings.
Minister Siobhan Brown.
Thank you, Presiding Officer. The Scottish Government provides funding to a range of voluntary sector bodies who can provide support in relation to family disputes. Support may also be available through the legal aid system.
Emma Harper.
Thank the Minister for that answer. I've been working with a family in Wigtonshire who are in the same position as many others, where a contact order was given by a sheriff for a father to have contact with his son months ago, and it is still not being complied with. The Minister will know that I have corresponded with her on this issue, but would she agree to meet with me to explore whether, such as for criminal cases, a change could be made to the law which would compel a party to comply with a court order in a Scottish family court?
Minister.
Thank you, Presiding Officer. Delay in child contact proceedings is not in the child's best interest, and I recognise the negative effect that non-compliance and with contact orders can have on a child. If a person believes an order has not been obeyed, they can go back to the court and they can ask for the order to be varied, or they can ask for the person who did not obey the order to be held in contempt of court. New case management rules for family actions in the Sheriff Court came into effect in September last year, and these are intended to help to prevent undue delay in proceedings relating to welfare of children, and I would be very happy to meet with Ms Harper to discuss this further.
Thank you. Question number 2, Ariane Burgess.
To ask the Scottish Government what assurance it can provide to the community on Mull regarding whether Learning Estate Investment Programme funding can be used flexibly to support both the construction of a new high school in Craigmuir and the refurbishment of the existing site in Tobermory for nursery and primary provision.
Cabinet Secretary Jenny Gilruth.
I can provide the member with a direct assurance that within the Learning Estate and Investment Programme there are a wide range of locations, including remote sites, and a variety of school types, including campuses and stand-alone schools, new builds, extensions and refurbishments, depending on the needs of different communities. Initial discussions with Argyll and Bute Council are based on the LEAP's policy of like-for-like replacement funding, but also recognise the specific circumstances of the existing Tobermory campus and, for example, the likely increased costs due to the island location. Therefore, LEAP funding based on like-for-like assessment could potentially support the construction of a new high school in Craigmuir and the refurbishment or replacement of the existing site in Tobermory for nursery and primary provision, if that is deemed to be the best option. Any additional costs arising from not pursuing a like-for-like approach would have to be borne by the Council. We will continue to work with the Council to support the development of this project.
Ariane Burgess.
I appreciate that answer from the Minister. I'm raising this issue because the community have come to me, and unfortunately this is another example of island communities feeling their voices are unheard and their very particular challenges overlooked. The Special Islands Need Allowance is supposed to recognise the increased cost of delivering services to island communities, but it has dwindled due to a failure to link this to inflation. Will the Scottish Government seek to address this unfairness?
Cabinet Secretary.
I thank the member for her question. First of all, I very much recognise that some certain members of the community strongly feel that having a split site option with early years and primary remaining in Tobermory and a new secondary school being built on a site in a more central island location would mean that families would no longer need to send their children to Oban. So I recognise the unique circumstances that the member speaks to. The member has highlighted in the Chamber today the Islands Needs Allowance. Of course, responsibility for that does not rest within my portfolio responsibilities. I'm more than happy to write to the member directly on this, although I suspect it will be another minister responding to her on that ask. But I go back to my original response, Presiding Officer, in relation to the flexibility with regard to LEAP funding, which is that if Argyll and Bute Council decide that a two-site option is best for their community, there is flexibility within the LEAP fund at the current time to reallocate the funding from a single campus to the two-site proposal. But of course that additionality would have to be borne by the local authority.
Question number 3, Claire Haughey.
To ask the Scottish Government how the Scottish Budget 2025-26 will support the NHS.
Cabinet Secretary Neil Gray.
Thank you, President Officer. With record funding of over £21 billion provided in this year's proposed budget, we aim to improve patient experience, ensuring the journey from diagnosis to treatment to aftercare is as straightforward and stress-free as possible, a commitment to provide £200 million to reduce waiting times and improve capacity, with a vow to make the system more efficient and reduce delayed discharge. It means that by March 2026, over 150,000 extra patients are expected to be treated as a result. Despite substantial funding increases, significant challenge remains, meaning that prevention and reform remain critical to delivering a sustainable health and social care system.
Claire Haughey.
Thank you, and I thank the Cabinet Secretary for that answer. And I remain Chamber. I hold a bank nurse contract with Greater Glasgow and Clyde NHS. My constituents often contact me regarding support for long-term health conditions. In particular, access to diabetes technology has been raised by my Rutherglen constituents with me. Can the Minister detail how measures in this year's budget will support those requiring long-term treatment?
Cabinet Secretary.
Thank you, President Officer. I thank Claire Haughey for bringing up a point that is absolutely central to the elements of reform and improvement that I spoke about. Addressing concerns around long-term conditions and managing them better is central to those aims, and the Government is committed to supporting people with long-term conditions for those reasons. On the question of diabetes tech, this year alone we've provided funding for 2,100 people to receive a hybrid closed-loop system. It will continue to support these people with recurring funding for as long as they use the system, and are working on plans for expansion in 2025. The 25-26 budget also includes an additional £4.5 million to deliver new specialist support across the country for the likes of long COVID, ME, chronic fatigue and other similar conditions. And this important investment will support people with these conditions across Scotland, and we're asking Parliament to unite behind the budget to ensure that these funding elements reach the people who really need it.
Brief supplementary, Carol Mockin.
Thank you, Presiding Officer. A recent Audit Scotland report on alcohol and drug services recommended that Scottish Government must increase funding to tackle alcohol-related harm by mid-2025. However, the budget indicates that these services received a real terms funding cut. How does the Scottish Government respond to Alcohol Focus Scotland's assessment that the budget in its current form is lacking in the ambition and determination needed to tackle Scotland's alcohol emergency?
Cabinet Secretary.
Thank you. I thank Carol Mockin for raising an important issue, and one that is a priority for this Government. And we have maintained alcohol and drug funding, including the National Mission funding of £60 million a year, the £250 million across the lifetime of this Parliament. We've also baselined a significant amount of money, £19 million into ADP funding, to give long-term certainty, which is what was one of the asks from alcohol and drug partnerships. And of course, alongside the funding that we provide, there's also wider health board intervention that isn't readily available within the budget document, that speaks to services being delivered in communities. And on that basis, I hope Carol Mockin can be reassured that this remains a significant priority for this Government.
Question number 4, Emma Roddick.
To ask the Scottish Government whether it will provide an update on how it is tackling child poverty, including in the Highlands and Islands region.
Cabinet Secretary Shirley-Anne Somerville.
The Scottish Budget for 25-26 outlines plans for wide-ranging investment to drive further progress in our national mission to eradicate child poverty. In addition to continued investment in the likes of the Scottish Child Payment, this includes our increased investment in affordable housing supply, investment to expand breakfast clubs, and by expanding free school meals to pupils in primary 6 and 7 who receive the Scottish Child Payment. Importantly, we have also committed £3 million to develop the systems required to mitigate the 2-child cap, with CPAG estimating that scrapping the cap could lift around 15,000 children out of poverty in Scotland.
Emma Roddick.
I thank the Cabinet Secretary for that answer, and note that today is Christmas Jumper Day, which gives us an opportunity to reflect on what more we can do to ensure that no child grows up in poverty in Scotland. As she noted, a number of last week's budget announcements, including the scrapping of Labour's 2-child cap and the expansion of free school meals, will help lift thousands of children out of poverty. Can she outline what more we could do and how much further we could go if this Parliament had the powers of a normal, independent country?
Cabinet Secretary.
Thank you, Presiding Officer. Emma Roddick raises a very important point, Presiding Officer, because it highlights the fact that under some of the most challenging budget settlements since devolution, we remain committed as a Government to over £3 billion in 24-25 to policies which tackle poverty and protect people as far as possible during the cost of living crisis. But she is also right to point out that we could do so much more if we had the full economic and fiscal powers of an independent nation, because only with independence would we stop having to mitigate against the UK Government. This year, £134 million for the bedroom tax, the benefit cap and others, nearly £500 million for the Scottish Child Payment, and next year the work that we will have to do to mitigate against the scrapping of the Universal Winter Fuel Payment and our work because there is still, unfortunately, the retention of the two-child cap at the UK. While the UK Government makes those decisions, we will take action now, but with independence we could do so much more.
Question number 5, Neil Bibby.
Thank you, Presiding Officer. To ask the Scottish Government how it determines what constitutes a major service change in the NHS.
Cabinet Secretary.
Thank you, Presiding Officer. Scottish Ministers consider a range of factors, including the views of Healthcare Improvement Scotland and the Health Board, before coming to a final decision on whether a proposed change should be considered major. NHS boards can also consider if a proposed change is a major service change themselves. Healthcare Improvement Scotland have published guidance to help NHS boards identify potentially major service changes, and the guidance poses questions for NHS boards to consider under 8 key areas, including impact on patients and carers, the level of public concern, financial implications and consequences for other services, amongst others.
Neil Bibby.
I thank the Cabinet Secretary for that response. Proposals to close Ward 36 at the RAH in Paisley for older adults, resulting in the removal of 22 beds, are proceeding despite significant opposition from NHS staff, the Unison Trade Union, families and patients, over the impact this could have on delayed discharge and the wider hospital. The Healthcare Improvement Scotland's guidance outlines key factors for designating a major service change, including the impact on patients and carers, changes in accessibility, public and political concern, consequences for other services and alterations in service delivery methods, each of which is clearly relevant to the closure of Ward 36. So in light of this, will the Cabinet Secretary pause this proposed closure until a full public consultation is carried out?
Cabinet Secretary.
Thank you. I thank Neil Bibby for raising an important issue, one that I also raised with NHS Greater Glasgow and Clyde and discussed with them at the recent board annual review that I was part of a couple of weeks ago. And I think, to be fair to Mr Bibby, he reflects one element of the decision but not the other in terms of what the capacity is going to be used for, because this specific ward has been used for some time for patients awaiting home care or care home placement who are otherwise medically fit for discharge. And in line with national policy on appropriately shifting the balance of care, minimising delayed discharge, the Health Board is embarking on a test of change where these resources will be directed instead to supporting hospital-at-home services in Renfrewshire. So the test will be kept under review. If successful, the potential for a longer-term change will be investigated. But I hope that puts that into greater context for Mr Bibby and his constituents, as well as the trade union representatives who I also had that discussion with, and gives them some reassurance as to the actions that have been taken by Greater Glasgow and Clyde.
Brief supplementary, Colin Beattie.
I understand that NHS board leaders were contacted 2 weeks ago by the Scottish Government, outlining a changed approach to planning of services in NHS Scotland, focusing on moving to population-level planning. Can the Cabinet Secretary please speak to how this will help meet changing needs of Scotland and build the foundation for the transformation of our healthcare services?
Brief response, Cabinet Secretary.
Thank you, President Officer. I think Colin Beattie raises an important issue here, that as part of the reform agenda we've developed a renewed approach to the planning of services in NHS Scotland to ensure that services planning takes place best aligned to the size of the population who make use of these services. There will be a significant change to the way that we plan and deliver services to enable to meet changing needs of Scotland's population and build the foundation for the transformation of our service. But to give reassurance, this is obviously based upon clinical input from our national conversation, as well as the views of patients, as I was able to discuss with patient representatives this morning.
Question number 6, Brian Whittle.
Thank you, Presiding Officer. To ask the Scottish Government, further to the publication of the Access Principles in November 2023 by the General Practice Access Short Life Working Group, what work it is undertaken to develop a set of standards or performance indicators to evaluate the performance of GP access models?
Cabinet Secretary.
Thank you, Presiding Officer. We continue to work together with all relevant partners to effectively implement the General Practice Access Principles, including through our commitment to the ongoing recruitment of primary care multidisciplinary teams, as well as 800 more GPs. Healthcare Improvement Scotland has already worked with over 100 general practices to improve access arrangements, and it is ultimately for individual practices to assess whether their access arrangements meet the needs of their patients.
Whittle.
Can I thank the Cabinet Secretary for that answer? Over the past year, GP services in my region have begun moving to purely digital points of access for the service. As the Cabinet Secretary is aware, I am hugely supportive of the use of digital infrastructure to relieve pressures on the NHS. However, the integration of digital services must not create barriers to access. Recently, I have become aware of access issues that have had negative impacts on patients, like increased waiting times for GP appointments or missed triage that have landed patients in A&E. Does the Cabinet Secretary agree this is an important issue to monitor as we change our access models, and how is the Scottish Government ensuring that integration of technology is properly resourced?
Cabinet Secretary.
Thank you. I think Brian Whittle raises two really important issues. One, that when we adopt new innovation, particularly where that is patient-facing innovation, that we must take people with us on that, and that we can't have an equity of access based on digital literacy in this case, as Brian Whittle is setting out. And secondly, the whole purpose of adopting innovation and taking forward greater digitisation is to improve and speed up, provide greater capacity within our service. And so that would be what I would expect to be coming forward. And of course, conversations are continuing with the BMA, the Royal College of GPs and others around how we can make sure there is an equity to access, and also that we can improve capacity on the back of the budget proposals that we've taken forward on providing greater capacity within primary care and general practice in particular.
Question number 7, Maggie Chapman.
To ask the Scottish Government what action it will take to enhance the sustainability of cultural facilities in the North East Scotland region, including to prevent job losses in the sector and improve support for cultural education.
Cabinet Secretary Angus Robertson.
Thank you, Presiding Officer, and to Maggie Chapman for her question. Creative Scotland have invested over £30 million in applications from individuals, from projects and organisations in the North East Parliamentary region since 2019, with over 1,400 awards. This includes over 40 projects totalling £1.7 million through Screen Scotland's Screen Education programmes, 6 Culture Collective projects totalling £2.9 million, 12 regularly funded organisations receiving a total of £12.5 million each year, and Youth Music Initiative formula funding to all 5 local authority areas in the region each year, which in 2024-25 totalled £1.2 million.
Maggie Chapman.
I thank the Cabinet Secretary for that answer. Culture is a fundamental human right, an important part of our expression and identity, and it has a positive impact on our lives and supports social connections and well-being. As Dundee marks the 10th anniversary of being the first and only UNESCO City of Design in the UK, key cultural organisations and the creative economies they support are at risk. Has the Cabinet Secretary engaged with Dundee Contemporary Arts, Dundee Rep and other organisations about their sustainability? And does he agree that the move to multi-year funding would give these cultural institutions the long-term financial guarantees they need?
Cabinet Secretary.
Well, can I say, I think Maggie Chapman makes an excellent point about multi-annual year funding, and as a result of the Scottish Government's proposed budget, there will be the biggest ever funding increase for the culture sector in Scotland outside COVID recovery. This will allow the introduction of multi-annual year funding for cultural venues and organisations throughout Scotland. However, I would gently say to her and to colleagues in other political parties across this chamber, this is only going to happen if MSPs pass the budget. So I hope Maggie Chapman will vote for the budget, will vote for the increase in culture funding and give the green light to multi-annual year funding.
Thank you. I'll just take this opportunity to remind Ms Chapman and all other members that large campaigning symbols are not allowed in this chamber. I'll take a very brief question, number 8, from Willie Rennie.
To ask the Scottish Government what its response is to reports that both privately run nurseries in the East Neuk in North East Fife constituency will close by the end of 2024.
Minister Natalie Dawn Innes.
I know from engagement with the sector that many providers are facing cost and workforce pressures, and the UK Government's changes to employers' national insurance contributions are only going to add to this. I continue to prioritise efforts to support providers in Scotland, and provided we have support from parties across the Chamber for this budget, we will give an additional £9.7 million to councils to enable workers in private and third sector services delivering funded ELC to continue to be paid at least the real living wage, meaning Scotland will be the only part of the UK to do so. We are also continuing our work with COSLA to strengthen the sustainable rates setting process.
That sustainable rate setting process is really important. Closing the gap between the funding for councils and private nurseries is part of the reason why these two nurseries are in difficulty. So can she update us about how quickly that gap is going to be closed?
I'm absolutely happy to provide an update on that. So, jointly with COSLA, we've established a Sustainable Rates Review Implementation Working Group that brings together sector and local government reps to inform delivery of the Sustainable Rates Review actions. A key recommendation of that review was to improve the cost data available to inform rate setting, and I'm pleased to update that the Scottish Government has just completed the commissioning exercise for a new national cost collection exercise, and this will take place in spring next year. We've also, together with COSLA, hosted 6 provider reference groups during October and November, and we've had really good involvement from across the sector in relation to that to inform that cost collection exercise. I've also got some other things to update Mr Rennie on, and I'd be happy to do that, as I believe I need to keep this short. Thank you.